Assalamu alaikum. I'm Dr. Asfandiar Khanzada, and today we will be discussing about finger clubbing. Finger clubbing is very common in different set of diseases, including pulmonary, heart, and liver. Pathophysiology of finger clubbing is the swelling of underneath soft tissues just below the finger. So what happens actually is that there is loss of convexity between the anterior posterior as well as the lateral margin of nail. The anterior portion, the anterior and the proximal portion of the nail get swelled up more often as compared to the lateral one, the distal portion, and then due to which the anterior diameter of proximal nail exceeds that of the distal nail and giving the shape of this clubbed finger. This angle between the skin and the proximal portion of the nail is also lost in this process. Usually, clubbing is symmetrical bilateral in hands and as well as in toes, but sometimes unilateral clubbing can happen too, just like in atrioventricular atriovenous fistula used for dialysis. So in that scenario, we will get a single-handed unilateral clubbing. But it's also very important to note that whenever the cause of clubbing is removed, just like the lung transplantation in cystic fibrosis, we see improvement in these clubbing, and eventually clubbing is lost in nails. Now, whenever you come across the patient having finger clubbing, there will be some differential diagnosis you have to consider before reaching final conclusive diagnosis. We divide finger clubbing into two categories: congenital and acquired. 10% cases are congenital. Now, in the series of acquired diseases, pulmonary tops the list. 80% of cases are because of pulmonary diseases. This includes pulmonary TB, which is a chronic disease, empyema, lung abscesses, cystic fibrosis, bronchiectasis. Tumors are also common with finger clubbing, which includes mesothelioma, fibroma, and other lung cancers. Coming towards cardiovascular, which makes up the little of this list, about 10%, and congenital heart diseases tops the list, and cardiac list, infective endocarditis and AV shuntings are common. After this comes the list of gastrointestinal diseases, in which cirrhosis tops the list, and followed by celiac disease. Other diseases are thyrotoxicosis of because of any causes can be the reason for finger clubbing. I will provide you with this sheet of a differential diagnosis so that it may be easy for you to diagnose someone with finger clubbing and make proper diagnosis. Keep watching these videos and follow for more content. Thank you.